Okay, welcome everyone, and thank you for attending this Lunch and Learn organised in collaboration between the Knowledge and Library Services at NCIC and Boost, which is the North East and North Cumbria's Learning and Improvement Community. My name is Ashley Eaton and I am from Boost. And today we are joined by Dr. Angela Rodrigues, who is an associate professor at Northumbria University. And Angela's going to be presenting for us today an introduction to behaviour change for health, strategies, models, and real-world applications. If you could hit the next slide for me, please, Angela. Thank you. So these Lunch and Learns are a relaxed and informal space for health and social care staff to come together and share their experiences. Next slide, please, Angela. And then before we start, just some very quick protocols. If you can keep your webcams off during the session, that would be much appreciated. Mute yourself when not speaking. If you post any questions in the chat, and we'll also make sure that we've got some time for questions at the end. Listen with respect and be present. Please pass on, share the learning, spread the word about these sessions, and please be aware that we are recording. We will put a link to be able to give feedback in the chat, so if you're able to complete that, that would be much appreciated. It's just a couple of questions. I will now hand over to Angela.
Thank you so much for having me today. So thank you, Ashley and Amy, for the opportunity to present. I'm an associate professor in psychology at Northumbria University, and I specialize in behavior change interventions. And today, really, I'm only going to provide a very brief introduction to behavior change and behavior change models and their application to health improvement. We're going to explore one in particular and the importance of understanding behavior before developing strategies, and we're going to use some practical examples as well. So why is it important to focus on behavior change in health? What we can see looking at the top causes of death is that there has been a shift since the start of the 20th century until today. So many problems observed in today's society can be linked directly or indirectly to behavior. I'm looking more precisely at behavior risk factors, as we can see in this graph. And there seems to be a link between behavioral risk factors and the top causes of death in the UK. This is particularly in England. And I just wanted to highlight that dietary risk factors and tobacco smoke, as we can see in this figure, account for the most deaths. So there is a clear relevance to study behavioral risk factors, but also to work on behavior change interventions. So behavior change, what we know is that people don't always make decisions and take an action in a straightforward way. And people really struggle to translate those intentions, that wanting, into actions. And it's often not related to motivation. We know that people are motivated, they know why they should be doing, but that other things get in the way. And because of that, I guess behavior change interventions get often labeled as complex. And maybe you know a few of them. So my next slide, I will ask you to maybe put on the chat, type the sort of behavior change interventions you have been involved or have heard of, just to get a little bit of overview of the sort of scope here. So using the chat, if you don't mind, just typing the sort of things that you've heard of being involved in. A couple of minutes and then we'll just move on. Okay, so exercise more, stop smoking interventions, very popular. Combi, yeah, reducing strong pain medication, alcohol reduction. So there's a few that you've highlighted, and I guess it is interesting to see the range. Brief interventions, yeah. But a lot of them, and it's actually interesting to also see some models coming up. So the stages of change and combi, but a lot of the interventions that that you've mentioned, such as the stop smoking services, they have behind there has been awful lot research or studies, if you want, to develop those and to understand exactly what are the barriers or the drivers for specific behaviors in order to develop those interventions. So that's another reason why they often label as complex, in the sense that, for instance, just taking the stop smoking intervention, one of the key, there's several levels to it, and if we think about, there is a level of initially training staff to be comfortable and confident on delivering such advice, and then also the component that is directly aimed at the patients or clients. So there's already two levels of sort of focus of the intervention, and that's one of the reasons why we call it complex interventions. You might see that a lot in the literature. But like I said, a lot of them have quite a lot of theories and development behind. And I guess you, in the chat, you've already mentioned too. I'm not sure if anyone wants to add to that. Feel free to type in the chat what theories, if you want, of behavior change do you know? So we've mentioned stages of change and combi. Is there any other that you've heard of? Can't see any more on the chat. So I guess motivational interviewing, yes, very relevant, particularly when talking about brief interventions, for instance. I work quite a lot in brief interventions, so motivational interviewing is quite relevant within the context. So what I'm going to briefly mention today is another model called the behavior change wheel. And the behavior change wheel is the guide for designing behavior change interventions. It provides you a step-by-step guide on how you might approach this process. It was originally developed by appraising several frameworks out there for behavior change and trying to create a more concise way of bringing it all together. It has several layers that you can see by looking at the colors of the wheel, but today I just want to focus on the middle. So the core of the behavior change wheel is the combi model. And the combi is the starting point for understanding behavior and the context where it might happen. And according to the combi, the behavior will occur as a combination of three elements. So capability, motivation, and opportunity. Capability can be physical or psychological. So let's use, for instance, vaccination. In order to give a vaccine to someone, you need to have the physical ability, or being able to actually perform their behavior. But also you need a psychological capability of understanding why you're doing, understanding the instructions. So having that knowledge base. In terms of motivation, let's say, for instance, automatic motivation, you do it as a habit. So it will occur every time you're in that specific context, but also reflective motivation, which kind of entails the sort of the reasons why you might be doing it. Why do you think it's important to to vaccinate someone. And finally, opportunity can be social opportunity or physical opportunity. In terms of physical opportunity, we think about the environment. Let's say that maybe in your office, there's a lot of cues, a lot of prompts that remind you to give a vaccine every time you're in that space. But in terms of social opportunity, you might also know that all your colleagues are very supportive of this particular behavior, and even the organization really tries to foster this. And it's part of their own culture and policy. So all of those elements will create the necessary conditions for the behavior to occur. And now that we've looked at the models of behavior change, an interesting way is to look at how can we go from the theory to actionable techniques. And a way that we do this is through the use of behavior change techniques. And here I like to make a comparison with medicines. So when we look at a medicine, we look at the components and we know straight away what are the active ingredients, why are we taking that, and what is the sort of mechanism of action. And the behavior change techniques came around for the same sort of purpose. So when we describe interventions, everyone uses the same terminology and we know exactly what people are using. So let's say you see an intervention somewhere else in a different setting and you want to apply in your setting, and they have a very detailed protocol, and you can see that they start by, for instance, providing information, and then they move on to problem solving. And by understanding what are those techniques, then you'll be able to implement in your own context. So behavior change techniques are really important to be as specific as possible as to what exactly are we going to include in our interventions to bring about behavior change. And now that we briefly mention Combi and BCTs, using the example of the smoking cessation here, we can see how we might use specific behavior change techniques to target specific elements of the combi. So for instance, let's say we wanted to target capability, then we might advise on stop smoking medication. Or if we wanted to target motivation, we could provide rewards, for instance. And in terms of opportunity, we could advise on avoiding smoking cues. This is just an example of how we might link the combi model with BCTs, in this case for smoking cessation. And I'm only going to focus on 2 behavior change techniques today. There's not enough time for everything. So I'm going to first mention goal setting, which maybe a lot of you are very familiar with this. And this is the script that you might use with a client or a patient to, for instance, agree on a quick date with the client. It involves working with the individual, being very specific, being something new to them. And research has shown that the ideal scenario is that we work with someone, so there is support in coming up with a goal setting. And you might use some of the questions on the screen to make it as specific as possible. Sometimes you might be able to go through all the questions. Other times it's just it could be as simple as agreeing on a date and how exactly, just thinking about that in specific. Another behavior change technique that it's usually very, very much linked with goal setting. And I forgot to add that I also brought these 2 specifically because they are the most commonly used in the literature, and there's a lot of evidence on them. So as I said, usually paired with goal setting, we have the action plan. And this is really trying to work with the client or with the patient to come up with a detailed plan on how exactly they're going to put that goal into action. So it's trying to be as specific as possible as to how, where, when, what exactly does it entail? Are they going to do it with someone else? It's trying to build on this to make sure that at the end you'll have a specific plan on how it's going to happen. A ready action plan is particularly important because it really helps to go from that stage of being motivated to actually coming up with translating that motivation into a plan and an action. So my next slide, or next few slides, is trying to work together through an example, and I hope the chat option is going to really help us with this. So I want us to go back to the example of vaccination uptake and really working through maybe some of the barriers and then together some of the potential strategies. So if you don't mind using the chat again, I would like us to think about what are the main barriers to vaccination uptake. And if you don't mind using the chat, you can just type in something really short, one word, or just small sentences as you prefer. And okay, I'm opening the chat now. Okay. I can see a lot of mentions of mistrust or misinformation, accessibility issues as well, such as time constraints, but also transport access. What else? Fear. I guess it goes hand in hand with misinformation potentially. Okay, I guess other people's experience or social norms maybe come into play. So I guess in general, not seeing as important. So there's a lot of this is linked to a lot of the literature in the area as well. So a lot of mistrust, accessibility, something as well to do with social norms. And now I want us to maybe concentrate on one of two. So either misinformation and accessibility, for instance. And maybe we can think about, just brainstorm some strategies on how we might address the barriers. Again, using the chat, maybe we can just go through some potential solutions. Any sort of strategies that we could use, maybe for misinformation. So we have education, public campaigns, education from peers. Okay, so using, kind of trying to also get that social opportunity in and using social norms to change. Brief interventions and as well, and staff training at this level. So I guess like a few of you mentioned, education and information as being a really important issue here, particularly to address trust or misinformation. Very important at that level. But also you've also mentioned social norms and involving others, involving peers, and this would be another important strategy to consider. So really good ideas. So I guess this quick activity shows how identifying barriers and applying strategies grounded in behavior change models can really help develop, if you want, interventions that might change at the population level. So this is understanding the barriers and then coming up with solution that would solve those barriers is a really important step in developing interventions. So I hope this works. So there's a little video that I have on here that kind of summarizes all of this.
All improvement involves change. Sometimes this is really positive and easy to embrace. Sometimes, though, it's challenging and can involve emotions such as fear or uncertainty. To help make positive changes, we need first to understand why. The COM-B model helps us to understand, does someone have the capability, opportunity and motivation, and enables us to think this through. Is it that people can't change, they don't have the capability, or that they lack the opportunity? Or is it that they won't change, they don't see the necessity or have concerns? Let's look at an example. This family have all seen the articles about the benefits of healthy eating, so they agree that next week they are going to eat well. But at the moment they don't see the necessity to change their behaviour. They aren't overweight and they do lots of exercise. Next week, Dad is told by the doctor that he has high cholesterol and he needs to cut down on fatty foods, so they agree they really are going to eat healthily. This has overcome the motivation barrier as they now see the need to change. Let's see what happens. This time we have a capability issue. Dad simply doesn't know what to do with the ingredients he has in order to cook a healthy meal. Next time they buy some cookbooks, build a meal plan and resolve, once again, to do better. But wait, there just isn't the opportunity. To change and improve, we need to ensure that there is the motivation, capability and the opportunity. Once an improvement has been achieved, in order to ensure that these new behaviours are sustained, we need to build habits so that our behaviours become automatic. It's helpful to start with a plan, learn from failure and make it easy to do the right thing. Where capability, opportunity and motivation exist, change becomes easier. As coaches, COM-B can help us understand this better and move towards sustainable improvement.
So I hope that provided a quick overview of, sorry, I need to find of behavior change and the use of the COM-B in particular. But if you want to learn more about behavior change, then I also run a 2-day masterclass that covers issues relevant to behavior, to interventions to develop behavior change interventions, and we go through the designing, the implementation and the evaluation if you want. The other thing is that I normally ask people to bring their own challenges, and then we work through that specific challenge all the way through all the activities, and by the end hopefully you'll have sort of a plan to tackle that specific challenge. So thanks once again for the opportunity to present today, and more than happy to answer any questions that you might have. So thank you again.
Brilliant. Thank you so much, Angela. That was really interesting, and I find behaviour change absolutely fascinating. So if anybody wants to put their cameras back on and ask any questions or pop them in the chat, please feel free. That would be great. Angela, I was just thinking for myself there, talking about action planning and goal setting. We do that in my coaching sessions. I was just wondering, is there any research around writing it down? Because I'm sure it definitely improves, but I've got no idea if there's any kind of evidence to back that up at all.
Yes, there is quite recent evidence actually using the NHS DPP, so the Diabetes Prevention Program, that shows that you doing it with someone, but actually being very structured about goal setting improves. And so they looked at whether people remember afterwards being told how to do goal setting and whether they enacted. And when they had their support and they actually were very structured on goal setting, people could remember. So there's I'm happy to share if you want.
Brilliant. Thanks, Angela. I think Helen's just popped her hand up. Helen.
Yeah, hi, thank you. Really great session. Thank you very much.
Thank you.
Do you know if there's any research we have access to some research available, but just wonder if you're aware of any that is showing that not having weight change as an outcome measure improves engagement and activation levels.
So not having the specific measurement of doing it regularly, you mean, or just at all?
No, whether people's engagement in changing behaviour and beneficial behaviours is sustained for longer if it's not tied to a weight change outcome.
There is quite a lot on maintenance, and but there is some evidence that shows that monitoring is actually really good for maintenance, alongside other things.
Yeah, but I just think that so the work we're doing is about untying, basically destigmatizing behavior change.
Yeah,
because it's so under the barrier of weight loss, and that's the main driver of people's engagement.
Yeah.
So but I think really we focus our work on the 2/3 of people that don't either delay engagement or don't engage at all, because they've perhaps previously lost weight, regained weight, lost weight, regained weight, and the behaviors that they did to change their weight in the first place aren't kept. So we're really looking at ways to improve people's health without monitoring weight. And I was just wondering whether you had any access to any data that proves that that's beneficial.
So it's not something that I'm particularly familiar with. Most of the things that I've seen, as I said, for maintenance do have a component of monitoring, though there has been some recent, having said that, there is quite a lot coming through on weight stigma, and kind of changing quite a lot of the training in this area to move beyond some of the standard advice that we used to give to patients.
We're one of those trainers, but I just thought I'd explore. So sorry to put you on the spot.
No worries. No, thank you. It makes me think, and I will go away and have a look, actually. Thank you for that.
Super, Angela. Thank you.
Thanks.
Brilliant. Thank you so much, Angela. Really do appreciate you coming along and sharing that knowledge with us.
No problem.
Are you happy for the slides to be shared out afterwards? Is that okay?
Yes, of course.
Thank you. So if anybody would like the slides, if you can pop your email address in the chat, because it doesn't always come across on Teams when we download the attendance. So if you'd like the slides sent to you, please pop your email address in the chat. So thank you everyone for attending. Just a reminder, we have put a link to be able to give feedback in the chat. Our next Lunch and Learn session is on the 4th of December at 1 o'clock. And we'll be joined by Lorna Watson, who is a speech and language therapist at North Cumbria Integrated Care Foundation Trust. And she's going to be talking to us about using affirming professional language in our practice. So we hope to see you there. Once again, thank you so much to Angela, and I hope everybody enjoys the rest of their afternoon. Thank you.
Thank you. Take care. Bye.